Hello, and welcome to today's webcast brought to you by the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, at American Institutes for Research in coordination with the Campbell Collaboration. The Center on KTDRR is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, known as NIDLR, in the U.S. Department of Health and Human Services Administration for Community Living. The Campbell Collaboration is an international organization that promotes positive change through the production and use of systematic reviews and other evidence synthesis for evidence-based policy and practice. The Center on KTDRR partners with Campbell's Disability Coordinating Group to help increase the number of Campbell reviews in the disability field. I'm Joanne Starks with the Austin Office of American Institutes for Research, or AIR, and I'll be the moderator today. I also want to thank my colleagues, Shoshana Rabinovsky and Ariana Hammersmith, who are helping with the logistics. The KTDRR Center and the Campbell Collaboration are working together to offer a 5-part training course that focuses on high-quality methods for synthesis of evidence, including the procedures and methods for conducting systematic reviews, as well as software, tools, and strategies for analyzing and reporting data. Today, we will learn about several software tools for managing and analyzing data in systematic reviews. In the third and final part of today's live session, Martin Morris will introduce Rayyan. Mr. Morris is an associate librarian at McGill University in Montreal. His current principal research interest is the improvement of library services to traditionally underserved communities, particularly LGBTQ communities, and with a strong focus on health sciences librarianship. He has also published on knowledge synthesis and the spread of innovations in library information settings.
Good afternoon, everybody, and thank you to the AIR for this invitation to talk about Rayyan. I will mention straight from the outset that I have no formal affiliation with the people who run Rayyan at all. I believe I was invited because we use it commonly at McGill and because we have a resource guidance on. So I, this afternoon, will give you a run-through of the platform and of how it works and talk about some of the main functionality. I believe that should take about 20 minutes. It may take a little bit less, but it should take about 20 minutes. And then I believe it's questions at the end. So I'm just going to move on. And I believe at this stage, Joanne, if you could share my screen. Okay, so let me just log out. So Rayyan is somewhat like the first tool that we heard about, which was Abstractor, in that it is open source. It is a web-based platform, and it is maintained by the Qatar Computer Research Initiative and by a group of people who actively maintain the platform. It is a tool for screening.
Excuse me, Martin, we're not seeing your screen.
Oh, are you not?
You need to press.
Okay.
Press that button there.
Do I need to press that? Hold on a second.
There we go. It's happening now.
I'm sorry about that. Excuse me. Okay. So where was it? Yes. So the Rayyan platform is maintained by the Qatar Computing Research Initiative. It is free. It is not open source in the sense that the source code is not made available, but it is free to access to anybody without any payment whatsoever. It is particularly good for recording screening decisions, and that's what it does really well. Other functionality tends to be a little limited, so it is very much on the completely free to access, no charge whatsoever end of the platform, with very good functionality for recording screening decisions and for recording conflicting decisions and so on. It is not so good in terms of PDF management, and it doesn't offer any functionality for data extraction and so on. We have found it popular at McGill because it is relatively easy to use. It does manage screening decisions well, and I think part of the attraction is that it is completely free, so often it is popular for postgraduate research projects and so on. So if I go to the initial home screen, and I will show you how to set up an account. So this is the initial screen, which is rayyan.qcri.org, which redirects to a welcome screen. And you can see that in addition to the web-based platform, there's also a screenshot here for the offline iOS screening tool, which I'll talk about a little bit more later on, but I'll just mention that that does exist. And to create a new account, it's simply a case of pressing sign up and then filling in these basic options. This used to need to be approved manually by a member of staff at the QCRI, but is now automatic, so the account is created immediately. I won't go into any further detail in terms of typing in details because that's pretty obvious, but once that account has been set up, you then log in like this, and you are presented at the point of login with a screen that looks much like this. And I'll point out some of the features on this screen. So my reviews are reviews that I have created myself. There are 4 categories of collaborator, or there are 4 roles on the Rayyan platform, which is the review owner. So I am the review owner, and I am the person who created the test, for example, and 29th of November workshop. If another person creates a review and then invites me as a screener on that review, I become a collaborator. And here you can see that there are, these are collaboration reviews, and I am a collaborator on this review on nurses' knowledge of vascular access. I was in fact invited to provide some assistance on the screening process. There is also the role of translator. So if you have a Rayyan project, a screening project which involves abstracts in other languages, there is a role to allow somebody to come into the review purely to translate abstracts. I haven't used it myself, and I'm not aware of many people using it. It seems an interesting feature to add to the system. And then other reviews are public reviews that people can play with to get used to the screening process without actually affecting their own review at all. Now, at this stage, I'm going to create a new review, and the way that we recommend people do that generally is through an EndNote library. It is possible to import various other types of data, such as PubMed exports, export files from Scopus, ENW files from Google Scholar, and so on. We find personally that the best way of working with this is to first of all have a deduplicated library in EndNote, and then to export those results into Rayyan. So I'm going to create a review first of all, which is done by new review. The description is optional but could be useful. And then at this point, I press create. And at this point, you can then see these are the different types of file that Rayyan will accept. And I have previously created an EndNote export, but as a tip, excuse me, that's not how. It's not showing up. Let me hold on a second. Here we go. So this is a typical EndNote library that we use when we're teaching Rayyan workshops here at McGill University. And the basic process is to select your references and to export in text format as EndNote Export. I won't go ahead and do that, but that is the process. And that then creates an export file like this. And that's what it looks like. That can then be imported into the Rayyan platform, and the way we do that is to select a file. There's the file. It's a very small export, it will not take long. And then I press continue. And it takes a few seconds, at which point here are the references. The left-hand side may need refreshing. And here we are. And at this point, we then have our complete set of references, which we are going to go ahead and screen. The left-hand side provides general information about the Rayyan library, including limited duplication matching. We recommend doing as much as you can to deduplicate an EndNote first, because this functionality is not perfect yet. But if I click on here, you can see that this is what it thinks the duplicates are. But I won't go ahead any further with that because we don't tend to use it very much. This section here is for inclusion and exclusion decisions. So as the review progresses and as decisions are made, I will see at this stage my own screening decisions, but I will not see the screening decisions of anybody else. And I will talk about how that is unmasked shortly. Then there are various other terms. Rayyan tries to recommend certain terms from an analysis of the text of the abstracts that I think might be helpful to you in making screening decisions. It creates a tag cloud of topics. It advises on what PDFs you have currently uploaded, and there are none currently there. And then it gives information about the journals and the authors and so on. So you may or may not find that useful. At this stage, we can then basically go ahead and start screening. I will not see, as I say, anybody else's screening decisions, but I can go ahead and have a look at my own screening decisions. And the functionality shows how I can do that. So if I wish to include this reference, for example, I can either just press the button I, or I can click the include button, which will have exactly the same effect. If I decide I wish to exclude the reference after all, then I can either press the exclude button or the letter E, and you can see that my name has appeared for this reference, either in green if I wish to include the reference, or red if I wish to exclude the reference. If I decide I want to delete my decision instead and maybe rethink about it, I can make it undecided by clicking the U button, and at that point my name appears there, but there's no screening decision that has been made. And then I can simply go down and make further screening decisions as I go along. Clearly, I would want to be able to give information about why I have excluded a record if I choose to do so. And this section here, reason, allows me to nominate or to provide a reason for excluding my record. So I could, for example, simply decide that it's the wrong drug, and I could use one of the predefined exclusion reasons. Or I could provide my own reason, such as, for example, data cannot be extracted. And note, as a relatively new feature, that if I provide that reason, the reason will be made available in this drop-down box to every other person working on the review. So the exclusion reasons are common. And we recommend to research teams here at McGill University that they perhaps agree on the wording they're going to use first of all, so that the first person who provides that screening, that exclusion reason, uses the correct wording, and it is then made available to everybody else. In the same way, we can also label articles, which you could refer to as an inclusion decision, or you can use that functionality in other ways. We, for example, have decided on occasion that the data, the body of references may in fact be better screened as two separate bodies, or that one subset of the literature could be screened later on because it covers a different concept or a different area of the literature. And that has occasionally led to two different reviews happening, where one set of articles can be labeled simply with an inclusion label or some kind of tag at the time. I cannot see the Adobe Connect screen, so I don't know whether there are questions coming in or not at this stage, and I don't wish to sort of split between the two. So I'm hoping that there are no questions that I'm missing at this moment.
No questions.
No questions. Okay then. Super. The different key options on the left-hand side of the screen can be used to filter records. I should be clear. So, for example, I can show only the records that have been excluded. Excuse me for a second. The records that have been excluded simply by pressing the excluded button. And there I can see that now I'm only showing records that have been excluded by me. And I can unclick that to remove that, or I can show the undecided records. These are, it is possible to combine these. So if, for example, I wish to see only undecided records that have the word prevalence in, I can select both of those, and these are undecided records where the word prevalence exists, for example. So I can combine these different options. If I wish to see only articles that are in the Lancet, that is also possible, or articles by a certain author in the same way. So those are ANDed as a way of combining the different decisions together. So at this stage, I have created a review, and I am the owner of this review, and I'm very lonely because I'm the only person currently involved in this review. So at this stage, I would want to invite other people to help me screen my articles, and to do that, I go back to All Reviews, which is here, and we come to a screen that you'll be familiar with, and then I choose the review that I'm currently working on. This functionality shows just me at the moment, and it shows what progress I have made in screening my articles. And this is a small pie chart because there are a small number of articles. I can, at this point, then invite other people to collaborate with me. And I previously invited my alter ego on a separate email address, which I shall now do. And then I press invite. And one thing I forgot to mention, which I will go back and do, is that at the stage where I'm inviting somebody, I can decide what role they have. So you will remember that I talked about collaborators, translators, and viewers earlier. I can decide which role the person will have. And sometimes, for example, if there's a principal investigator who will not actually be doing screening, but who wishes to observe the review and see what progress is being made, I could invite them as a viewer, which I didn't make clear earlier on, and that is something that we sometimes do. Now, if the person I invite does not have a Rayyan account, they will get an email inviting them to create an account, at which point they are then automatically added to the review. And at this point, I can now see, this is me with my McGill account. This is the total screening summary of everything that's been done by everybody, of which this is the screening that I have done, and this is the screening that the invitee, which is just me and my other email account, has done. You can decide for yourself whether you think it's a good thing that you can see other people's, the proportion of other people's screening decisions. Personally, I think this is something I would like not to see, and I wish it were a little more, that the information were not quite so clear, because I think this could bias screening decisions, but this is the information that is given. The next thing that happens, once a person is invited, is we then have the option of whether blinding should be on or whether it should be off. And this button, blind on, appeared at the time that I invited my first collaborator. And blinding being on means that I currently cannot see what screening decisions have been made by any other person involved in the review. So I am that is completely invisible. And if I go back and show, and the platform is having a little think, please don't crash in the middle of the presentation, you can see that I cannot yet see any other information about other reviewers. I'm not going to switch back blinding back onto this review, but I will show you another example instead, if the system will load for me. We're currently having a slow moment, which is the first time I've ever experienced this, and of course it happens in the middle of a webinar. I apologize for this. Well, while we're waiting for that, I will, oh no, here we go. Nope, that's going to be a few more seconds. While we're waiting for that, I will jump ahead slightly, and I will talk about other aspects of article screening. So I mentioned this, for example, this, by the way, is a LibGuide, which we believe provides a fairly comprehensive introduction to Rayyan, which is on the McGill Library website. The URL for it will be provided in the next slide shortly. And this provides quite a lot of information on getting started and on basic information about the Rayyan platform. And one thing I do want to demonstrate to you, to show you, is this here, which is an example screen from the mobile app for iOS, for Apple phones, for Rayyan. And this is really rather handy because it allows the collaborator, the researcher, to download all of the references onto their phone and then to make offline screening decisions, simply by clicking on include or exclude. So we describe it in our workshops as Tinder for journal articles in Rayyan. And at the same time, it is possible also to label in the same way as I described before, or to give reasons for exclusion for journal articles. And this means that this allows for off-site and offline screening to be done within Rayyan. The next time that the device is connected to the internet in any way, those screening decisions are automatically re-uploaded into the system. I'm going to hope at this stage we are now back. This is wonderful. So I was showing you before the blinding, and if I show this previous workshop, and this is a fuller example of a large number of different screeners. The pie charts are going to load up. It's having a little bit of a slow moment. And here you can see that blinding has been turned off. That functionality is available only to the owner of the review, the person who originally set it up, and roles cannot be changed, so it is not possible to assign ownership to another person. But here with blinding being off, if I go into this review, and I'm hoping that will be possible, having a little think about it. What we will see is a listing of the articles for that particular review, and you can see here that it is clear who has accepted the article, who has rejected the article, and reasons given for doing so. And with blinding turned off, conflict appears as a selectable option on the left-hand side, and this shows only those articles for which there is not agreement about whether the article should be included or not. And this then allows for discussions to take place about how the article should be included, whether the article should be included or not. The other thing that happens when collaborators are invited is that we get this rather useful little review chat on the right-hand side. I'm the only person who's online at the moment, and this allows for a conversation to happen between the people who are online. So this is quite a nice way of having conversations with people if they are working in different places, who want to, for example, discuss which articles should be included and excluded out of that list where there was previously conflict. So this appears, as I say, only when collaborators are invited, and that can be minimized like that. I'm going to go back to the review that I was working with for this particular workshop. I want to talk a little bit about PDF management because this links into the recommended workflow that we suggest at McGill for switching from the title abstract stage of the screen to the full text stage of the screen. And I'm going to select an article and I'm going to upload a PDF to show how this works. So here we have an upload PDF full texts option, which I'm going to select, and then I'm going to add PDF files, and I have a random PDF here. I have a choice at this stage of whether I'm going to upload the PDF as private, which means it will only be available to other collaborators in my review, or whether I wish to make it available to the entire world. Clearly, there are copyright and licensing issues in doing that, so we wouldn't formally recommend that people do. But I'm going to upload it as private. And you will see, once I've done this, that the functionality is quite limited. So here we have the PDF now listed within that abstract, but there's not really very much I can do with it. Other people can see it, so it's in a way a possibility for sharing literature, but I can't annotate it in any way. And if I click, it just demonstrates, it just shows the PDF in a separate screen in that way. There's nothing I can do. There's nothing clever that I can do with it. So for this reason, the general workflow that we recommend to people, because we don't have the ability to flip to full text screening in the way that, for example, Covidence has, is we recommend that once the initial round of screening has been done, that the included stroke undecided articles are then exported and then re-imported into a new Rayyan review, and also imported at the same time into an EndNote, a collaborative EndNote library, because EndNote we find is much better for managing full-text PDFs. You can share annotations, and that seems to work well. So at the second stage, we do recommend that workflow. I'm nearly ready to conclude. So I will mention some other limitations as well. But the interface is currently available only in English. There isn't functionality for data extraction, so on. As I say, it really does just do the screening decision management, but it doesn't go much further. And it's also, unfortunately, not possible to edit citations. If I wanted to add notes of some kind here, or if I spotted something I wanted to change, that unfortunately would also not be possible. So once I have the results in the review, they are there, they are static, and they cannot be changed. So Joanne, I'm going to switch back now to the, I'm ready to stop sharing. So I think here we go. So thank you for that. That is more or less all I have to say regarding the brief tour of the Rayyan platform. Joanne, if you could sort of advance my slides to show the LibGuide address. We do provide, just one slide back. We do provide, as I say, the LibGuide functionality for Rayyan. Unfortunately, in most cases, we do get, well, not unfortunately, we get quite a lot of requests, several a day, from researchers around the world who've landed on our LibGuide, who are using Rayyan, who have questions. And unfortunately, because of time issues, it is hard for us in most cases to respond to those, other than to say that unfortunately we can't help. You're welcome to try and contact me, depending on the simplicity of your question, and I'm willing to try and answer questions, but I can't really get involved in sort of helping with particular problems that you're having in your reviews. But I do invite you to consult our LibGuide if that is helpful to you. And okay, I think that is all I have to say for the moment.
Well, thank you so much, Martin. That was a really nice demo of all the features of Rayyan. And we did have one question. I think you probably have covered it. The questioner was wondering if there was an offline way to use Rayyan. And I know you also mentioned the mobile version.
So I would recommend the offline way would be to use either the iPad or the iPhone option. Rayyan itself is a web application, so you would have to be online to access it through the website. So I think the iOS application would be the best way of working offline if you wanted to screen while not being connected to the internet.
I want to thank our presenters for taking time to prepare and to introduce these software tools to help manage and analyze data for systematic reviews. We hope you will take a few minutes to give us some feedback about the webcast by filling out a brief evaluation. The link is listed in the slides. You only need to respond once after you have viewed all 4 videos. I also want to thank the AIR staff and representatives from the Campbell Collaboration who helped with planning and logistics. And of course, we want to thank NIDLR for their support to offer these webcasts and other events.